Hi, and good evening to everyone. Thank you for joining me as I take on a very important but complex subject around what can happen when things go wrong in the pharmaceutical industry. This is big because I have been looking for ways to try and make a parallel to what I see happening today with regards to the pandemic. And a lot of that concern is because of the science. As I've always said, I've been focused on the fact that severe COVID 19 is likely to be a viral mediated autoimmune disease, and therefore one has to be extremely cautious with how you approach trying to manage that kind of intervention. So, today I'm going to be covering just about three areas that I think are quite relevant. The first thing is a paper or an article from Reuters about a McKinsey, and then going to be talking about the actual paper itself, the promotion and marketing of Oxycontin. And as well, I'll be highlighting a few bits from this FDA hearing with regards to Oxycontin at the time. So that's essentially what I'll be doing. And if you want to understand what this is about, you have to watch this series on Netflix. Fascinating series. I've learned so much by watching it. It's called Painkiller on Netflix. And if you have access to it, it's well worth the time to get an understanding as to how that error occurred and what could be relevant for us today. So before I start, I'd like to encourage you, if you have not yet registered and you're interested, I'll be talking about what I expect to be a cancer explosion, which I think is already happening. And critically, I'll be looking at the possible mechanisms. I'll be covering a number of points. As you can see, you can register for free if there are free tickets left, but covering a few points about immunity, how I think autoimmunity could fit, interferon P53, SV40. And my aim is to try and hopefully simplify the concepts so that it is easy for people to grasp some of the challenges that we are likely to face. These are important areas. And I usually highlight that while some people don't necessarily agree with my position on things, it's because I've been looking at the research for a very, very long time. And I can highlight here a few points. This was in July 2020. This was a post that I did where I was identifying already the frailty around COVID 19 and medical research, and the fact that at the time there were over 800,000 deaths. We didn't have a good, clear understanding. We were focused only on finding a vaccine. And I was saying that we need to approach this in a much better way. So, this is why I'm saying when I'm speaking about these things, these are important topics. And they've actually been they've been well thought out over a long period of time. So let's get to the crunch of the matter. Well, you have here, firstly, an article from Reuters, and this article was published in September 27th, 2023. And it's because the consulting firm McKinsey had to pay 230 million for the latest US opioid settlement. And this was because they were involved in the promotion and marketing of Oxycontin, which is opioid, an addictive opioid. And essentially, they had to pay this because it was argued that they were involved in spreading information. Looking down the bottom here, the lawsuits accuse them of contributing to the deadly drug crisis by helping drug manufacturers, including Purdue Pharma, design deceptive marketing plans and boost sales of painkillers. So, this is why they had to do a settlement on this for 230 million. And so, this is just within the past month, the 27th of September. Purdue was promoting Oxycontin between 1996 and 2001. So this is now 20 years beyond the event that the compensation is just starting to come through. This is the reality of what we're facing, and why I think we need to be so very careful at this point. So let's go into a little bit more detail about this specific paper that I'm talking about. Here we have, this is by Art Van Zee. This was in February 2009. As I said, Oxycontin, an opioid, a derivative of oxycodone, was being marketed by Purdue Pharmaceutical, and they were pushing this drug simply because they were utilizing the fact that they got around the regulatory oversight. Now, it was, as they said here, compared to non controlled drugs with their potential for abuse and division pose different public health risks. And so somehow this drug, which is a controlled drug, managed to evade the regulatory control of the FDA. And we'll come into how that happened in the first place. But it was a very significant thing because it took about 5 years of aggressive marketing by the company before this was again challenged by the FDA. And so you have here again, as they look at controlled drugs with the potential for abuse, in that time, the promotion and marketing of Oxycontin, sustained release oxycodone preparation, illustrates the point about aggressive marketing. So Purdue Pharma brought it in 1996, brought it to market, got it past the FDA. It was very aggressively marketed and promoted. Sales grew from 48 million in 1996 to almost 1.1 billion in 2000. And this high availability of Oxycontin increased abuse, diversion, and addiction. And it became the leading drug of abuse in the United States by 2004. And so this was a pretty significant event that occurred. And part of the question is, how did it occur in the first place? How did it manage that this drug that was so addictive ended up getting past the regulators and in front of people who then became addicted to it? Well, the strategy that they used, and I'll show you here again, the strategy that was used by Purdue was very simple. So between 1996 and 2000, they then did 40 national pain management speaker training conferences, resorts in Florida, Arizona, and California. They targeted about 5,000 physicians, pharmacists, and nurses, all expenses paid symposia. And what they then did is that their marketing strategy was to identify physicians who were already prescribing opioids. So the drug companies looked at the prescriber profiles on individual physicians, and then they targeted them to promote Oxycontin. And they use quite significant bonuses from their specific sales representatives. And when you look at the series Painkiller, they were always really attractive young women, and it seemed to be able to capture the attention of the clinicians who then went on to prescribe it. So it was a very sophisticated marketing campaign that they used at that time. And so over 5 years, they made huge amounts of money, but at the same time, they created significant drug addictions. Now, why am I making this analogy? Because in the context of what is happening in COVID 19, it wasn't actually the companies that were promoting it, it was governments. And so they can step back and say, actually, we weren't doing any promotion with regards to vaccines. It was governments who were doing that, and they chose to do that. The problem I find is that there were pieces of information that were relevant to governments to understand that were not challenged. Like, for instance, when governments were talking about the fact that the vaccines completely stop transmission, and if you all take that it will stop the pandemic, they knew this wasn't accurate. And this was not challenged at the time. So there is a responsibility to not just listen, and simply because it's not you promoting it, you still have a responsibility if the wrong thing is being promoted to challenge that and make sure that that challenge is held. Now, I'm going to jump to another part before coming back to the paper. I'm going to highlight the link to the FDA hearing that occurred, I think it was about in 2004. So, this is the full FDA hearing. It's quite a long document. But there it's a bit here that I found really fascinating about what occurred here. And so I think it's Bernie Sanders who was part of that, who was part of the challenge. And they identified that 45% of the budget at that time for the FDA came from user fees and the pharmaceutical industry. At the moment, it could be much higher than that. And they highlighted that one of the commissioners, the gentleman named Curtis Wright, he was not even a commissioner in the FDA, but a high ranking official. In 1996, he left the FDA, received a 400,000 compensation package at Purdue Pharma less than a year after he approved Oxycontin. Now, what they're highlighting here is the fact that when they looked at the transition from the FDA to the pharmaceutical industry, they were finding that a significant proportion of people who were in the FDA then went on to work in the pharmaceutical industry. And it represents a conflict of interest. And we have seen this quite recently with one of the very senior people who was involved in the UK moving to one of the big vaccine companies. And again, there is nothing wrong with that because the expertise may be relevant. But it's difficult when you are seeing a situation where something is being promoted in a way that could be challenged. Let's be clear about something. I have an issue with the fact that we did not target in the context of the pandemic. As I've always said, we knew who was high risk. We knew who needed to benefit the most from an intervention. And the question is why was it rolled out to the whole population and in some countries all the way down to 6 months old? How is that even logical or possible when we know who is the highest risk for the disease? I find that this is where we are going to get caught out. It's not that it was done, it's the fact that it was done in a cohort of patients who would have limited benefit and only have higher risk in terms of adverse events. And this is what we're starting to see at the moment occurring at different parts of the world. So let's get back to the paper, and it highlights again where we are today. The problem that happened at the time was that the company, Purdue Pharma, misrepresented the risk of addiction. So, in truth, addiction is between 3 and 16% of the general population with opioids. However, somehow in their literature, they were able to get away with saying that Purdue claimed that the risk of addiction from Oxycontin was extremely small. Now, again, I'm going to make a parallel because we have heard this kind of discussion in our current day to day existence. The risk, the adverse events are extremely small. I think it's extremely small if you're not looking for it. And as we can see with what happened with myocarditis was an extremely rare risk at the beginning, was actually considered misinformation to discuss it. At the moment, if you actually look for it, the numbers are staggering with how many people can be affected with either elevated troponin levels, even children with ECG changes. This is quite significant. And this is where I said the same errors that occurred with this particular drug, claiming that the risk was extremely small without doing the thorough investigations, will come back to bite. And this is an extremely important part of where we are today. And I can't tell you how worried I am in the for the future because we don't fully understand the longer term implications of what it is that has been done. So yes, and this was the point that occurred with regards to this particular Purdue Pharma. It was misrepresenting the risk of addiction proved costly for Purdue, And in 2007, they, along with three company executives, they pled guilty to criminal charges of misbranding Oxycontin by claiming that it was less addictive and less subject to abuse and diversion than other opioids. They had to pay 634 million in fines. Let's be clear about something. 634 million sounds like a lot, but over the lifetime of this company, I think they earned close to 26 billion. So there was still a lot of money that was going to different parts of their organization, to investors, shareholders, because they were able to utilize the system. Only three people, it seemed, were considered to have criminal convictions. I don't as yet know whether or not any of them were jailed, and I'm not yet finished with the series painkiller. But as I said, it's really fascinating to see how this worked in real time. So our lessons for today are very, very simple. Our lessons are that we know that there is the potential and the risk that can occur with corruption or with regards to financial subversion influencing those who make decisions in the benefit or should be for the benefit of the population. Whenever that can occur, you have to be extremely careful and you have to challenge, you have to look, you have to make sure that errors weren't being made. That's my question or my interpretation of a parallel that only occurred just over 20 years ago when we had regulatory failure. And critically, that regulatory failure occurred because of one person who was actually initially putting up resistance, but was able to be paid off, it seems, to a certain degree in terms of salary and position and bonuses that allowed an error that went on to affect, I think it was over 800,000 people in the United States. This was a huge error in terms of regulation, and I would hate for it to occur again. There are lessons to be learned, and there are many things that we have to take into consideration when we reflect on where we are today. I've always maintained that without a good and thorough understanding of a disease, it is very, very dangerous to apply therapies very broadly across a population. That has always been my concern. When you have high risk and high risk populations, it's very reasonable to target them, because if you don't, the risk of not treating or not intervening can be higher than the risk that could be associated. In this case, I still maintain that history is going to show the error that occurred in this pandemic was one of what I think was political influence and financial greed. If they had stuck to what was supposed to have been done, stick to the high risk cohort, and across the world, not just in first world countries, in the high risk cohort across the world, and if the population had then developed herd immunity, I do think that the pandemic would be over across the world and not localized epidemics in highly vaccinated regions. That's what we're seeing now. I always challenge anyone who disagrees to take a good look at Africa and consider how, with limited resources at a health level, they have moved beyond the pandemic. Lessons to be learned? Let's hope so. But sometimes the lessons can be quite painful and can come at a significant cost. Have a great evening. I hope you found this valuable.